All right, ready to dive in. Today, we're tackling pediatric sepsis coding.
Ooh, that's a big one, especially for those CDS specialists out there, making sure those ICD-10 codes are, well, accurate.
You know it. We've got some excellent sources to guide us through this tricky area.
And tricky it is. These little ones don't always present like adults do, when it comes to sepsis, I mean.
Exactly. That's where coding gets, well, interesting.
Interesting is one word for it.
A teenager with, let's say, certain symptoms might look like sepsis, but in a newborn, perfectly normal.
Absolutely. And that's where we got to get a handle on, pediatric systemic inflammatory response syndrome.
SIRS, right?
Bingo, SIRS. And that's where your expertise as a CDS specialist really shines. Let's say you see a note like possible viral syndrome monitoring for SIRS.
Okay, I'm seeing it. What's the next step?
Well, you got to think SIRS itself isn't the diagnosis, right? So you'd query the doc, see if they suspect an infection causing those SIRS criteria.
Ah, I see. Because that infection piece is key for the coding.
You got it. ICD-10 codes and all that, it can make all the difference.
Big difference for sure. So let's break down these SIRS criteria. What exactly should we be on the lookout for?
Well, we've got four main players: temperature, heart rate, respiratory rate, and that white blood cell count.
Got it. But there's a twist, isn't there?
Always a twist with these little ones. The abnormal range totally depends on the kid's age.
Oh yeah, that makes sense. We actually have this handy table from one of our sources. It breaks down those age-specific values.
Oh, that's a lifesaver. A heart rate of, say, over 180 beats per minute. Red flag for a newborn.
But for a 10-year-old,
Yeah.
probably just ran a lap around the playground.
Exactly. And that's where you, my friend, as the CDS specialist, come in. You spot those subtle differences.
Make sure that age is documented clearly.
You got it.
Okay.
Because if it's missing or unclear, oh boy, coding errors galore.
Yikes. Not good. Okay, so we've got those age-specific values. What else is crucial for coding pediatric SIRS accurately?
Okay, listen closely. You need at least two of those parameters to be off. Abnormal, that is.
Okay, 2 or more.
Right. And at least one of them has got to be either temperature or the white blood cell count.
So just an elevated heart rate and respiratory rate, not enough.
Nope, not enough. Got to have that temp or WBC out of whack, too.
This is getting complex. It seems like there's a lot of room for interpretation. A headache for coders, I imagine.
You can say that again. And to make matters worse, documentation can be, well, vague.
Oh no, vague documentation. That's never good.
It's a nightmare. Phrases like rule out sepsis or sepsis physiology. Common, yes. Helpful, not so much.
Yeah, those don't exactly scream sepsis is present, do they?
Not at all. And that makes accurate ICD-10 coding, well, nearly impossible.
So what can CDS specialists do when they hit those vague phrases? Just throw their hands up.
No way. This is where your communication skills come in handy. Time to query that physician.
Ah, get that confirmation.
Exactly. You see, rule out sepsis, but the patient ticks those age-specific SIRS boxes, and there's a confirmed infection. Time to ask.
Okay, what kind of question are we talking about here?
Something like, based on the patient's age, those vitals, and that positive blood culture, can you confirm if sepsis is the definitive diagnosis?
Gotcha. So it's all about bridging the gap between the clinical talk and those coding requirements.
You got it. Making sure everyone's speaking the same language, so to speak.
Speaking the same language, I like that. And it's not just about codes, is it?
Nope, it's about the whole picture, the patient's condition, I mean. And that picture impacts everything. Resources, quality initiatives, you name it.
Wow, so CDS specialists are playing a vital role here. They're ensuring that the data is accurate, and that impacts the entire system.
Couldn't have said it better myself. And don't forget those hospital-specific guidelines. Some places, like Phoenix Children's, have their own criteria for diagnosing sepsis.
Oh, that adds another layer of complexity.
It sure does. A CDS specialist there, they need to know those internal rules. Make sure the documentation plays by them.
Okay, so give me an example. How might those hospital-specific guidelines be different?
All right, so at Phoenix Children's, they need proof of organ dysfunction to code for sepsis. You see SIRS physiology, but no mention of organ issues.
Sounds like query time.
You betcha. You might ask, given the SIRS physiology, are there any signs of organ dysfunction? Like elevated liver enzymes or maybe acute kidney injury.
Wow, okay. So it's not just about those general guidelines. It's about knowing the ins and outs of each institution.
You got it. And just when you think you've got it all figured out, those guidelines, They shift.
Oh, no, shifting guidelines.
Yep, there's a move away from that traditional SIRS approach,
Okay.
especially in pediatrics.
What's taking its place?
The Society of Critical Care Medicine, they're introducing the Phoenix criteria.
Ooh, things are getting interesting. Tell me more about these Phoenix criteria. How do they differ from the SIRS criteria we've been talking about?
Well, the Phoenix criteria, they're all about nuance, focusing on organ dysfunction and other specific markers. We'll dig into the details in a bit. But first, let's understand why these changes are happening. What's wrong with the SIRS approach? What problems are the Phoenix criteria trying to solve?
Okay, I'm all ears.
Uh-huh.
Let's unpack the Phoenix criteria next and how they might change things up for documentation and coding.
You know, this whole shift to the Phoenix criteria, it really shows you how much this area of medicine is, well, constantly changing. It's not just about memorizing the rules.
Right. It's about understanding why the rules are what they are.
Exactly. You got to be ready to adapt as the science changes.
Absolutely. So tell me, why are these new criteria gaining traction? What's wrong with the SIRS approach? What are the Phoenix criteria trying to fix?
Well, one of the biggest issues with SIRS is it can be a little too sensitive. You know,
So sensitive.
he might have a kid who meets the criteria based on their vitals and all, but they don't actually have sepsis.
Ah, I see. So you end up with overdiagnosis.
Yeah. Exactly. And that leads to unnecessary treatment, which, well, it's stressful for families. And it's expensive for the healthcare system, too.
Definitely. Sounds like the Phoenix criteria are aiming for a more precise definition of sepsis, focusing on the cases where organ dysfunction is a real risk.
You got it. The Phoenix criteria, they're all about organ dysfunction, plus other markers like high lactate levels or maybe altered mental status.
So it's about identifying the kids who are really sick, the ones who need more, well, aggressive treatment.
Exactly. And from a coding standpoint, that means CDS specialists need to be even more on top of the details.
So we're not just looking for abnormal vitals anymore. We need evidence of organ dysfunction too.
You got it. And that might require getting a little creative with your queries.
Creative queries.
Yeah, you might see a chart that says, like, suspected sepsis, but there's no specifics about organ function.
Ah, so you need to dig a little deeper.
Exactly. You might ask something like, can you clarify if there are any signs of organ dysfunction, like elevated creatinine, low urine output, or maybe altered mental status?
That's a good example. It shows how CDS specialists can be proactive. Make sure the documentation supports accurate coding, even with these new guidelines.
Absolutely. And it's not just about querying, you know, it's about education too. Making sure clinicians understand why these details are so important for coding.
Right. It's about that collaboration. Clinicians and CDS specialists working together.
Exactly. Education is key. Help those clinicians understand the reasoning behind the Phoenix criteria and how to document their findings in a way that, well, makes our lives as coders a little easier.
I like it. Maybe create some tip sheets or give presentations.
Exactly. Or even just have a quick chat with the doc, you know, one-on-one.
Sounds like CDS specialists are right at the forefront of this whole shift towards the Phoenix criteria, bridging the gap between the clinical world and the coding world.
Couldn't have said it better myself. It's a tough job, but it's so important. When it comes to these kids and sepsis, accurate coding can truly make a difference.
Okay, so we've talked SAROS, we've talked Phoenix criteria.
Yeah.
But what about the actual ICD-10 codes? What do CDS specialists need to know?
All right, so the codes you'll see most often are A41.9 for sepsis, A41.01 for severe sepsis, and A41.02 for septic shock.
Got it. A41.9, A41.01, A41.02.
Right, but there are also codes for specific types of sepsis, like A41.89 for other specified sepsis, or A41.81 for sepsis caused by streptococcus pneumonia.
Wow, there are a lot of codes. Seems like you need a pretty deep understanding of the ICD-10 system to get this right.
Absolutely, and that's why staying up to date is so important. You know, coding guidelines change all the time, continuing education courses, that kind of thing.
Makes sense. So much to keep track of. We've covered a lot of ground here. SIRAS, Phoenix criteria, ICD-10 coding. It's a lot to take in.
It is, but I think the big takeaway for CDS specialists is this. You're not just coders, you're advocates for good documentation, accurate and complete documentation.
We need all the details.
And by understanding the clinical picture and those coding guidelines, you make sure the data reflects the reality of these cases.
Right. These cases are complex.
They are. And now that we've talked about all these potential documentation pitfalls, how can you, as a CDS specialist, address them?
Okay, so what are some practical strategies? Using effective queries and education, that kind of thing.
One of the most effective things, really practical, is developing those standardized documentation templates or checklists even.
Oh, checklists. Those are always helpful. Especially in a busy hospital, right? Clinicians are running around, a million things to do.
Exactly. Having those prompts right there in the EHR makes all the difference.
Clinicians are more likely to document everything we need. If it's easy to do, right?
Exactly. Plus, it helps us with those queries. You know exactly where to look for those key details.
So you're not digging through a whole note trying to find that one piece of information. Nope. You see what's missing? Boom. Targeted query. Saves everyone time and a lot less frustration. Everyone wins. And speaking of queries, what about creating a query library?
Oh, yeah. I love that idea. Specifically for pediatric sepsis, of course.
So a bunch of pre-written queries that CDS specialists can just grab and go.
You got it. Tweak them a bit for each case, but the basic framework is there. Saves a ton of time, keeps things consistent.
And it helps with communication too, right? Between the CDS specialists and the clinicians.
Absolutely. Everyone knows what to expect, builds those relationships, makes things run smoother.
It's a win-win. And remember, those queries, they're not just about, checking boxes.
Right. It's not just about getting those codes right.
It's about getting the full picture, the whole story of what's happening with the patient.
Exactly. And that information, it's gold. Helps with resource allocation, quality improvement, all those big picture things.
So CDS specialists, they're not just code monkeys, right?
No way. They're playing a strategic role.
Yeah.
Using their knowledge to actually improve patient care.
Wow. It's pretty amazing when you think about it. So we've got those templates, those query libraries. What about education?
Education is huge. Regular training for clinicians on all things pediatric sepsis.
Diagnosis, documentation, coding, the whole 9 yards.
Yep. The more they understand, the better they'll document.
All about closing that knowledge gap, right? Clinicians and CDS specialists on the same page.
Exactly. And it's not just about the what, it's about the why. Why is accurate coding so important?
Right. What's the impact?
Explain how it affects reimbursement, research, the quality of care. Clinicians are busy, but if they see the bigger picture, they're more likely to make that extra effort.
Makes sense. And those training sessions, they're a great time to introduce those documentation templates.
Oh, for sure. It's all about collaboration,
Yeah.
building that shared understanding.
Okay, last but not least, let's talk technology.
Ooh, technology. It can be our best friend.
A lot of EHR systems have features built in to help with sepsis coding, right?
They do. Clinical decision support tools, those are great. Algorithms that analyze patient data, real time.
So they can flag potential sepsis cases before it's too late.
Exactly. It's like having an extra set of eyes constantly scanning for those subtle signs, especially in pediatrics, where things can change so fast. Early detection can it can save lives.
No doubt about it. So, CDS specialists, take note. Find out what your EHR system can do. If you don't have those tools, push for them.
Absolutely. Technology is a powerful tool. We need to use it to our advantage.
This deep dive has been incredible. We've covered so much ground. Pediatric SARRs, the Phoenix criteria, ICD-10 coding, even those practical strategies.
And it all comes back to those CDS specialists. They're the ones who make sure the documentation is accurate, the codes are right, and ultimately that the data tells the true story.
They're the unsung heroes of patient care, making sure those kids get the best possible treatment. So to all the CDS specialists out there, thank you. You're doing amazing work.
Absolutely. You're making a real difference.
This has been such a fascinating deep dive. Thanks for joining us. We'll see you next time. Keep up the great work.